All right, let's dive into some rapid revision for the UPSC CMS exam. We're going to power through questions 41 to 61 from previous years. Ready to get started? Let's go. Okay, first up, we're hitting a really important section, biostatistics and epidemiology. You know how fundamental these are, so let's see what they've got for us.
So, question 41. It's asking what two values you really need to describe the variation in a bunch of observations. Your options are A, mean and standard deviation, B, mean and range, C, median and range, or D, median and standard deviation. And the correct answer here is A. Look, the mean gives you the center point, right? The average. But the standard deviation, that tells you the spread. Are the numbers all clustered together or all over the place? You absolutely need both to get the complete story.
All right, question 42. What's the time period between when an infective agent gets into a host and when that host is at their maximal infectivity? Is it A, incubation period, B, serial interval, C, generation time, or D, period of communicability? The answer is C, generation time. Now, this is a classic tricky one. Don't mix it up. Incubation period is the time until symptoms show up. Generation time is the time until peak contagiousness. It's a super important difference for public health.
Okay, question 43. This one's about what makes a symposium a symposium. We've got 4 statements. So what's the deal here? Well, think about what a symposium is. It's a bunch of experts giving speeches on a topic, right? So statements 1 and 2 make sense. And the chairperson usually sums it all up at the end, so statement 4 is good too. But what about statement 3, a discussion among the symposium members? Nope, that's more like a panel discussion. In a symposium, they give their talks, but they don't debate each other on stage. That's the key piece of information that makes C the right answer.
All right, a matching question now, number 44. We're pairing insecticide groups with their names. Let's see, we've got stomach poison, organochlorine, organophosphorus, and carbamates. And the names are Temifos, Propoxur, sodium fluoride, and Dieldrin. So the correct code is C. Let's just double check that. Stomach poison, that's sodium fluoride. Organochlorine, Dieldrin. Organophosphorus, that's Temifos. And carbamates, Propoxur. Yep, it all checks out. This is one of those things you just have to memorize honestly.
Okay, question 45 is a spot the odd one out type of question. We have 4 diseases: Rift Valley fever, yellow fever, chikungunya, and West Nile fever. The question is, which ones are transmitted by the Aedes mosquito? The answer is A. Here's how you solve this quickly. You need to know that West Nile fever is the outlier. That one's transmitted by the Culex mosquito. The other 3, Rift Valley, yellow, and chikungunya, are all textbook Aedes-transmitted diseases. So you just get rid of West Nile, and there's your answer.
Question 46 is all about understanding the term prophylactic disinfection. So what does prophylactic mean? It means preventative, right? You're doing something to stop a disease before it even has a chance. So let's look at the options. Pasteurization of milk? Absolutely preventive. Disinfection of water by chlorine? For sure, preventative. But what about disinfecting a patient's urine or linen? Well, that's done after someone is already sick. That's called concurrent or terminal disinfection. It's not prophylactic. So the only true prophylactic measures here are 2 and 4, making B the correct answer.
Okay, question 47. This is a fact check on birth registration rules. Let's see. Statement 1 says it's the parent's responsibility only. Statement 2 says it has to be done within 15 days. Are these correct? Nope, neither of them is. So the answer is D. Here are the 2 key facts you need to know from the 1969 Act. First, the responsibility is on the head of the household, not just the parents. And second, the time limit is 21 days, not 15. Simple as that. Both statements are wrong.
Okay, let's switch things up a bit. We're moving into our next set of questions, and this block is all about public health and vectors. Let's see what we've got.
Question 48, a straightforward one. The Sullivan Index measures what? Is it A, disability rate, B, pregnancy rate, C, literacy rate, or D, quality of life? The answer is D, quality of life. The easiest way to remember this is that the Sullivan Index is basically your disability-free life expectancy. It's a measure of not just the quantity of life, but the quality of it. How many years can you expect to live without a disability? That's what it's all about. Okay, question 49 looks at the strategy to eradicate polio in India. It lists 4 things: national immunization days, mopping up rounds, acute flaccid paralysis surveillance, and public awareness. So which of these were part of the strategy? The answer is D, all of them. India's polio campaign was a massive, comprehensive effort. It wasn't just one thing, it was all of these working in sync to get the job done. A really incredible public health achievement.
Question 50, a biostats question. When you're talking about a z-score, which statistical distribution are you dealing with? A, normal, B, skewed, C, binomial, or D, Poisson? And the answer is A, normal distribution. This is a connection you should just burn into your brain. Z-score equals normal distribution. Z-score equals the bell curve. All it's doing is telling you how many standard deviations a point is away from the mean on that bell curve. That's it.
All right, question 51. It's asking about trans-ovarian transmission. Which of these vectors demonstrate it? Aedes, flea, ticks, or itch mite? The correct answer is C, which is Aedes mosquitoes and ticks. So what is trans-ovarian transmission? It's basically when the infection is passed down from the mother to her offspring through the eggs. It's like a vertical transmission, but for vectors. And this is a well-known phenomenon in ticks and certain Aedes mosquitoes.
Here's a classic PSM question for you. Number 52. What's the most sensitive indicator of a community's health? A, crude death rate, B, maternal mortality rate, C, infant mortality rate, or D, child mortality rate? The correct answer is C, infant mortality rate. Now, why is it the most sensitive? Because it's a reflection of so many things at once. It tells you about maternal health, nutrition, access to healthcare, sanitation, education, the whole shebang. If the IMR is high, you know there are deep-seated problems in that community.
Question 53 is about placing chemoprophylaxis in the right category. Is it A, specific protection, B, health promotion, C, early detection, or D, rehabilitation? The correct answer is A, specific protection. Think about the levels of prevention. Chemoprophylaxis is a primary prevention strategy, right? You're giving a drug to prevent a disease. And since it targets a specific disease, like taking anti-malarials, it falls under specific protection, not the more general health promotion.
Okay, question 54. Imagine you're a paramedical worker in the field. You need a rapid method for mass screening for malnutrition in kids aged 1 to 5. What do you use? A, weight for age, B, height for age, C, mid-arm circumference, or D, body mass index? The answer is C, mid-arm circumference, or MUC. Why? Because it's perfect for the job. It's cheap, it's fast, you don't need to know the child's exact age, and it's super easy to use. It's the ideal tool for that specific scenario.
Question 55 is asking for the most important single determinant of infant mortality. The options are A, birth weight, B, age of the mother, C, order of birth, D, interval between births. And the answer is, without a doubt, A, birth weight. All the other factors matter, of course, but low birth weight is the biggest single risk factor for an infant not surviving that first year. It's a hugely important indicator.
All right, we're on the home stretch now. This last block of questions is on immunology and health management. Let's finish this session strong.
Question 56, a classic immunology question. Which immunoglobulin can cross the placenta? A, IgG only, B, IgA only, C, both IgG and IgA, or D, neither? The answer is A, IgG only. Just remember G for goes across the placenta. It's the only one that can make that journey to give the baby some passive immunity. A very high-yield fact to remember.
All right, question 57 gives us two statements about vaccines. Let's break them down. Statement 1 says live vaccines give longer immunity than killed vaccines. Is that true? Yes, absolutely. They mimic a real infection more closely, so you get a more robust, long-lasting response. Now, statement 2 says killed vaccines need a single dose, but live ones need multiple. Is that right? No way, it's the other way around. Killed vaccines are weaker, so you almost always need multiple doses and boosters. So only statement 1 is correct, making A the answer.
Okay, another match the following. Question 58, we've got diseases on one side and incubation periods on the other. Let's see. Measles, diphtheria, hepatitis A, and hepatitis B. The correct code here is D. Let's just run through them to be sure. Measles is around 10 to 14 days, so that matches with 3. Diphtheria is pretty quick, 2 to 6 days, so that's 4. Hepatitis A, that's about 15 to 50 days, so it matches with 2. And finally, hepatitis B has that really long incubation period, 6 weeks to 6 months, matching with 1. Looks good.
Question 59 gives us a little clinical puzzle. Throat swab is positive, but the Schick test is negative. What's going on with this person? Are they A, suffering from diphtheria, B, susceptible, C, hypersensitive, or D, immune? The correct answer is D, immune. Here's why. A positive throat swab means the bacteria is present, but a negative Schick test means the person has antibodies, antitoxins, to fight it. So they have the bacteria, but they aren't getting sick from it. This is the classic definition of an immune carrier.
Okay, question 60. It asks for the exception among manifestations of psychosis. The options are A, psychoneurosis, B, schizophrenia, C, manic depressive psychosis, and D, paranoia. The odd one out here is A, psychoneurosis. Here's the fundamental difference you need to remember. Psychosis involves a loss of contact with reality. Think schizophrenia, paranoia. Neurosis, on the other hand, involves distress and anxiety, but the person's reality testing is intact. They know what's real. That's the key distinction.
And our final question, number 61. This one tests our understanding of two very important concepts, effectiveness versus efficiency. So which of these assertions are true? The correct answer is C. Here's the easiest way to keep them straight. Effectiveness is about the end result. Did you achieve your goal? Efficiency is about the process. How well did you use your resources? Time, money, staff. So, reduction in mortality, that's an outcome. A result, that's effectiveness. Cost per patient treated, that's about resources. That's efficiency. So statements 3 and 4 are the correct ones.